Allow me fixing everything, and let's answer today a few questions about pneumonia. I tried to find them under other videos comment sections because it's fresh in my mind and I can just answer them. Keep in mind, I'm not a doctor and I'm not a pediatrician, but my child has been hospitalized for the last 5 days, and I directly asked the doctors, so I have quite a few answers for you. Now, if you have any more questions, I would recommend asking your pediatrician, because pneumonia, it's a little bit tricky when it comes to treatment, because it depends. How old are you? How old is your child? Do you have any background of pneumonia before? Do you smoke? What do you work? And all this, yeah, that are very, very sensitive for the doctor's answer, yeah. So let's see a few of them. Can you engage in a physical activity and exercise, or it's better to rest? I'll tell you, until you have good oxygen saturation and until you don't have fever, yeah, so you should not have fever and your oxygen saturation should be good, yeah, rest. When you have good oxygen saturation and you don't have fever, you need to do exercise, yeah. For example, take a bottle, yeah, blow into it, just to move the airflow through your lungs. Do exercise with the hands up and down, go walk outside, have sun, yeah. Weather, for example, now is very good. So better it's to have exercise and cough all of the infection out of your lungs. It doesn't matter if it's a virus infection or if it's a bacterial one. Okay, next question is, can you get community-acquired pneumonia from traveling on airplane? How fast it can develop? Now you can, yes. You can actually get a virus, and this can go in a mixed infection with a bacterial infection, especially when your immune system is not strong enough. How quickly a pneumonia can develop? It can develop pretty quickly, in 24 hours, or it can develop in a week time. So it all depends on your body, yeah. But you can get it from everywhere. You know, maybe the best thing you can do is wash your hands and wear a mask if you are really scared of something. Okay, we'll find the next question. Some people want to go on antibiotics for a long time, and they're asking if they can continue with antibiotics. Now, antibiotics, we'll leave them for the microbiologists that actually develop and study this. You don't want to deal with the antibiotics yourself. They have a plan, yeah, antibiotics have a plan on the medicine. And if it's every 24 hours, you do it every 24 hours. If it's for 5 days, do it for 5 days. You can actually harm yourself more by not following the plan, yeah? So keep in mind, follow the plan, don't get more from what they gave you, and don't take less from what they gave you, yeah? If it does not work, you have fever, but if it does work, yeah, you are going to stop having fever and you actually start to cough, because all of the infection inside the lungs needs to be coughed out. So you'll continue coughing for at least 2 weeks after the antibiotics. If you have any pain after the course, yeah, it doesn't matter if you've been in a hospital, hospitalized, or if you been treating with a community pneumonia at home. If you have any pain in your chest, in the morning, in the afternoon, in the middle of something, yeah, speak with your doctor, tell him, yeah, very important. Even if you ask me, should I do something when you have pain? Answer is yes, tell your doctor. I cannot tell you what more. If you have pneumonia 3 times in a year, they say, is it possible to have pneumonia 3 times in a year? Yes, it is possible to have pneumonia 3 times in a year. But you need to look for the problem in yourself, most likely. So wash your hands more, yeah. your physical health, stay cleaner, yeah, wash your teeth, wash your mouth, yeah, something somewhere, yeah, it's causing this. So it is possible to have pneumonia after pneumonia after pneumonia and to get weaker. This will also affect your oxygen oxygen levels, so you need to be very cautious. Should you have X-ray before after the antibiotics? Most likely, if you're hospitalized, they will do you an X-ray on the way out just to make sure it's not spreading up. Should not. They'll see it on the blood works, but still they do it anyway, most likely. Now, if you are at home and you have problems, most likely you can ask your pediatrician for an X-ray after 4 weeks or 6 weeks after you catched it, because to see any change positively, yeah, to get rid of the infection, it needs to pass time. You need to have a lot of exercise and a lot of coughing to cough it out. You see it actually in the sink when you cough it out. Very interesting question. I was trying to see if I should go out in a cold day. Now, I asked the doctors and they said it's not a problem if you feel okay, which means that depending on the type of pneumonia, you can feel better and you can feel worse. If outside there is fog, yeah, it will actually make you feel worse. So if it makes you feel better going outside in the cold, do it. It's bacterial infection. Antibiotics catch it, not the air, yeah? So if it feels better, go try to do some exercise, and even if it's cold outside, put a hat on, yeah, dress yourself up, and yeah, go for a walk in the cold. So after all this chinwag, I tried to give you a few answers. If you have any more questions, put them in the comments. I hope there is people that can answer you as well with their knowledge, and I'll see you on to the next one. Bye bye.